In the course of medical progress, it's important for us to explore our new knowledge from several perspectives. Technology saves lives, that is certain. It's also certain that sometimes technology can be detrimental. I'm here today to discuss an element of healthcare that I think falls somewhere in the middle. What are the consequences of our lack of knowledge about safety in diagnostic imaging? And are there going to be negative health outcomes thanks to those misperceptions? Before my education in imaging, I had a love-hate relationship with X-rays. X-rays found my first cavity when I was 18 years old. An X-ray let me know that my twisted ankle wasn't broken when I rolled it under the snow my first semester at NAU way back in 1995. And X-rays let my kid's doctor know that their playground wrist injury was just a sprain. But my mom's X-rays weren't ordered in time to find the tumors that killed her. I was 22. My dad suffered a catastrophic brain and spinal injury when I was a small child. I grew up going with him to his doctor's appointments, his hospital stays, as a very unusual hobby for a small child. But I watched him PT his way back to walking and talking and working and thriving and living a really positive, fantastic life, all thanks to diagnostic imaging and his resulting treatment protocols. The gift in those experiences was that I wasn't scared of going to the doctor. I've never refused an exam. My parents were so sick when I was a child that I thought sickness was an inevitability, but detection could be my salvation. The true love of this part for me happened when imaging found my cancers in time for surgeries and a full recovery. Ironic that my children were about the same age as I was when my dad sustained his injury. Maybe them going to my doctor's visits and hospital stays would make them experts in healthcare too, and maybe it would save their lives someday too. There's some new science that's jeopardizing the way that my field can care for patients. I'm concerned about the psychological ramifications about the new science and how patients can act going forward. Overall, is psychology of their treatment more important than the medical care itself? Is it more important to be safe or to feel safe? X-ray technology was invented back in the late 1800s, and early high-dose radiation resulted in burns, cancers, and deaths. Lead and other metals were discovered as an effective barrier to this obviously potentially detrimental care. Lead aprons became common in medical practice back in the 1950s, and that, along with really great advances in digital imaging, has helped cut our patient dose by over 95% since those old days of radiology. But safety from that primary beam is still important, especially for our most radiosensitive places like our thyroid gland, our eyes, breasts, and our reproductive organs. Nearly all of us have had some kind of imaging exam. That could be X-rays or a mammogram, or remember your last dental X-rays too. Usually your provider will place a heavy lead apron across your body for protection. Here's some examples of lead shielding that you might be familiar with. So, what's new? In recent years, medical physicists have determined that lead shielding can increase patient dose. And according to the American Association of Physicists in Medicine, Lead shielding for routine X-rays should be discontinued. Here's the problem with that recommendation. Radiology is one of the medical fields that most of us know the least about. Ionizing radiation isn't exactly common conversation like diabetes management, the common cold, or even having cancer. I am concerned for our patients because I think that the fact that this new science means that lead shielding is going to be taken away, that patients are going to start to refuse these potentially life-saving exams without them. Recent polling I've conducted proves it. So let's actually just have a little bit of fun with how X-ray photons work. Your doctor's ordered an X-ray for you, and you're standing up against the wall across the room from me. And I take a handful of those little bouncy balls that you can get out of quarter machines. So I take these bouncy balls and I throw them at you, fast, hard, all at once. Those little bouncy balls shoot through you to create an image on the plate behind you. Here, you can see how the purple arrows show that those X-ray photons shoot through you, but it's in their nature to come right back out. So what does the American Association of Physicists in Medicine mean by lead shielding causing scatter to increase our dose? Here you can see that protective lead shield is actually causing those X-ray photons to scatter. The beams come inside, but now they have no way to get out. In this particular case, those photons bounce 4 times before being able to get out. This all happens at the speed of light, an unpredictable number of times, and it causes all of us more dose with each trapped bounce. These concrete scientific breakthroughs made national news in a New York Times article back in January of 2020. But most Americans don't know about this yet, let alone understand the science behind, the physics behind a very unique field with a very unique part of our well-being at stake. I do have concern for these patients. I believe that they are going to be refusing these exams. The polls I've conducted have proven it. 100% of my poll respondents were concerned about not getting a lead shield during an exam. 27% said they would be so concerned that they would think about it, but go along with their care. My largest demographic, almost 50%, said they would be so concerned about not getting a protective lead shield that they were going to stop the procedure. They were going to stop and call their doctor or contact the imaging practice manager. 14% said they would basically get on their phone right away and start frantically Googling to find out what was going on. 6%, they're walking out. No questions, no answered. Absolutely will not get an X-ray without that protective lead shield. A small percent, 3%, said that they would be reporting to the facility to the authorities. I believe these numbers are going to hold true as we see the next years of radiology in practice. How many broken ankles are going to heal incorrectly? How many cases of TB are going to be misdiagnosed, untreated? How many deadly diseases or cancers are going to be missed if our patients don't believe that we're not irradiating their healthy organs unnecessarily? After 70 years of lead shield use in medical practice, I have concern. Surprises don't go over too well when it comes to medical health and safety. Do you remember the years it took for all of us to buy in to reliably using seatbelts? Now let's apply that philosophy to using lead shielding. Except when a seatbelt works or fails, the results are usually immediate. When it comes to X-ray technology, we're talking about an invisible science with cancer at stake. This is a much scarier gray area of trust we're expecting from our patients. Look, the science the physics, the tech is solid. I am really, however, concerned about the psychological ramifications of taking our lead shields away from patients who have grown to know them as the be-all and end-all of radiation safety. So, how safe are X-rays? Really? Some common knowledge in my profession is knowing what contains or produces radiation. Perhaps some of the most fun is, well, produce. Bananas are a naturally occurring source of radiation, thanks to an isotope in the potassium. This isn't to scare you away from eating bananas, maybe more of a way to put your radiation dose into perspective. Do you think you eat a lot of bananas? Okay, well, Walmart says it's their top selling item. You'd have to eat a banana every 3 days for a year to equal the amount of radiation you get from living on this planet for just 1 day. And that is all still more radiation than you got from my chest X-ray just a few minutes ago. According to the EPA, flying in a plane across the country, while it's about the same as eating a banana every day for a year, is more radiation than you got from that chest X-ray or from living on this planet itself. Now, I don't mean this banana business to devalue the importance of radiation safety, more that it is a way to put your dose into perspective. According to the University of California's banana equivalent dose, all of these numbers, it's a real thing. I know. All of these numbers mean that X-ray technology is absolutely safe. You should absolutely be participating in your care and not be afraid of lead shielding being taken away. So the question that you might be asking yourself, truly, it would take eating tens of millions of bananas in just 1 day to kill you. But that's not really relevant. We don't absorb the isotope in that potassium anyway. Look, radiography is great. It's sound and reliable science. X-ray techs have taken images over the last 100 years that have diagnosed diseases, cancers, everything in between. X-rays are also incredibly safe. That chest X-ray you got from me is less radiation than we're getting from the planet ourselves, from flying across the country, or from the sun in the sky. Perhaps more difficult than us learning this new science is unlearning the bad science. So, I remain concerned and curious if over the next 20 years or so, patients are going to decline and deny getting very, very important X-ray exams now that lead shielding is going to fall out of use. So what is the takeaway? Well, while all of this is important, and I've enjoyed sharing this topic with you today, I invite you to have this conversation with your medical providers, because I believe when it comes to the decisions that we make regarding our health, that the perception is our reality. Thank you.